I've loved horses my whole life. So quit my corporate job and bought my first horse for my 40th birthday. I told my husband that I'd wanted one my whole life, and I was a grown-up and nobody could tell me no. So now I have 5. About 10 years ago, when my knee had started bothering me, I remembered stepping in a prairie dog hole, going way down, like up to my knee, and I thought, did I hurt my knee doing that? And I started noticing that my knee was bothering me when I was wearing my big muck boots, and it just got to where it was so painful that I finally went in and had my knee looked at.
Tennie, she came to me with debilitating knee pain, and unfortunately she had bone-on-bone arthritis.
The x-ray, he brought it out, and he didn't even have to tell me. I saw it was just bone on bone right there on the inside.
She couldn't do the activities that she loves to do, ride her horses. She leads a very active lifestyle, and this knee pain was really impeding that. Over the years, I've adopted what's called a muscle-sparing knee replacement, which is instead of the traditional approach where you cut through either the quadriceps tendon or the muscles around it, we actually go beneath the muscles and just kind of move them aside. And in so doing, patients can retain a more active lifestyle, they have a quicker recovery, more motor strength is maintained. So that's what we did for Tennie. We did that as our surgical approach, but we added another layer to her case. And so we offered her what's called the smart knee replacement. What this technology allows is essentially like taking the doctor home with you. There are sensors inside of this knee replacement that communicate with us through a cloud-based program on a regular basis so that we, as an office, can track our patient's progress. I can track her range of motion, I can track how many steps she's taking. There's no location tracking, it's just simply how the knee is functioning.
The doctor is able to access information on what it is that I'm doing, my activity level. And it kind of gives me a little bit of accountability too. I'm back to riding my horses, walking without pain.
Pain is just not a fun way to live, right? It takes a lot of mental energy away from you. And after having their knee or hip replaced, their true self and their true personality comes forth, and their joy of life comes back.
Definitely, it was worth it. The little bit of muscle pain that I had after surgery was nothing compared to the bone grinding pain that I put up with for years. So I don't regret it at all, and I would do it again.